like to introduce Dr. Jill Tolia. She'll be doing our presentation today. And I also want to I also want to thank Clara Moss for the lunch today. And don't be unnerved if this isn't any louder. This microphone is only for the camera, so it's not actually projecting my voice. I have these dulcet tones all my own.
Thank you. Hi, everyone. My name is Dr. Jill Tolia. Excuse me. I can be loud enough without the microphone. So I'm going to be talking to you guys today about immunization recommendations in adults. I'm an infectious disease physician. I work at Clara Moss. I have an office in Montclair. All my information is listed there if you guys had any follow-up questions. I'm going to keep this pretty informal today. I'm going to go through some information, but as I'm going, if any questions occur to you, please interrupt me. I want to keep this informal, try to answer all your questions, and maybe get a good dialogue going. So you guys have all in the handout there the first slide, which is really just from the CDC. This is the recommendations for immunizations in adults. And I should tell you, you all know, any of you who have children or grandchildren, you know there's very strict guidelines for the immunizations that children should receive. Many of them are required for them to enter into school. Many of them are required just in general on a day-to-day basis. Now, what tends to happen as you grow older, as you go into adulthood, vaccinations are recommended but not necessarily required. So a lot of people go through life and they say, I had all my vaccines when I was a kid and I'm fine and everything's good. But what we're starting to see for a number of different reasons, which I'll talk about, is vaccinations really are required in adults as well. There are specific ones that either due to the fact that as you get older, your immune system doesn't have immunity to a lot of those diseases that you were vaccinated against, or for other reasons due to the fact that there are new and emerging infectious diseases that are causing disease in older patients. So if you go through the list here, and I know it's a lot of information on here, we'll go through it little by little. There's a lot of specific vaccines that older adults should be getting, and specifically older adults should be getting as in specific parts of their life. So this first graph kind of lists that based on age. Okay, so as you can see, for 65 plus, there are certain things that are recommended at certain times of your life. So we'll come back to this. I'm just going to go step by step through each vaccination. So this is just a listing of some common vaccines that are recommended and or required in adults. Influenza vaccine, tetanus, shingles vaccine, which treats the varicella zoster virus, pneumococcal vaccine, which is a vaccine against pneumonia, the bacteria that's the most common cause of pneumonia, meningococcal vaccine, which you won't encounter too much in this group, but it's one that's recommended commonly in younger folks who are going to college for the first time and living in dormitories, hepatitis A and B, which hepatitis A and B is interesting because that's routine in children now, but that's only been for the last maybe 15 to 20 years. So a lot of us, myself included, didn't receive this as a routine vaccine in childhood. I received mine when I started medical school because I was a healthcare professional. But a lot of people who maybe don't work in the healthcare field never were vaccinated or are being vaccinated as older adults. And we'll talk about the indications for that. And then finally, Haemophilus influenza type B. So we'll talk about that a little bit too. So let's start with influenza. This is a common one. This is one that's coming up now that we're getting to the end of the summer and into the fall and into the winter months. It used to be influenza vaccine was recommended for certain people who have chronic conditions, people who are over a certain age, people who have diabetes, immunosuppression, things like that. Since the pandemic of influenza that happened, I think it was approximately 5 years ago, where we saw the avian influenza and we saw the bad strains of influenza where a lot of people were getting infected, influenza vaccine is now recommended for all patients over the age of 6 months. And this is across the board. Pregnant women included, people who have immunosuppression included, every single person should get the influenza vaccination. It's given once yearly. It's typically given in the fall to winter months. And as you probably have all seen, that's when your doctor's offices and pharmacies have it available. But the truth is, nowadays influenza vaccine is given year-round. If you weren't vaccinated in the fall and you happen to go for your yearly checkup in the spring, your doctor will still recommend that you get it. And the reason for this is we're seeing influenza year-round. We're not seeing it, there's no flu season, quote-unquote, anymore. It's all year-round, and it's so prevalent and it's so common that we recommend everybody get vaccinated any time of year. The benefit, of course, is if it's given correctly and if it works as it should, it will prevent you from getting the flu. It will prevent you from getting infected with the influenza virus. As we saw last year, as we see commonly, it doesn't always work 100%. And the reason for that is the vaccine is made to be geared at certain strains of the virus. And the way that the company, that they decide that is based on the most common strains that were in the world or in the US in the last year are targeted. So for the next year when they vaccinate, they target those strains. Now, it could be very common that a new up-and-coming strain is out there infecting people, which is not covered by the vaccine. Which is why even if you were vaccinated correctly and you did everything you were supposed to do, you could still get the flu. The advantage in that case of the vaccine is you'll have less severe disease because the strain you were infected with, although it's not covered by the vaccine, it's related to the virus that you were vaccinated against. So you'll have less severe disease, you won't suffer as much, and the other thing is you won't spread it to your friends and family members. So it contains the disease in all those ways. Common adverse reactions with the vaccine, people get a little bit of soreness at the site of the injection, you get a fever the day you get injected, you can sometimes get headaches and body aches. All of these things in my patients I usually pre-treat. I ask them to take a Tylenol or an ibuprofen the day they're getting vaccinated, usually prevents anything more severe. A few warnings about the vaccine. Obviously, if you have an allergy to any component of the vaccine, you can't be vaccinated. Specific to that is eggs. If you're allergic to eggs, influenza vaccine is contraindicated. You can't have it. If you're actively ill, meaning you have a cold or flu at the time you're going for your flu vaccine, you shouldn't have it. You should wait until the illness resolves and then get vaccinated. And GBS, which is Guillain-Barré syndrome, neurological condition, which can be worsened by receiving the vaccine. So that's just a warning. So as stated there, the influenza vaccine prevents infection with influenza A and B viruses, which cause influenza or the flu. Tetanus. Tetanus is a common one. Yes, question. GBS is Guillain-Barré syndrome. It's a neurological condition that has been shown to be worsened by the influenza vaccination. So if you have that condition pre-existing, you should not receive the vaccine. So moving on to tetanus. Tetanus is a common one, again, that every child gets, young. In adults, it's recommended for all patients aged 11 to 64. Should be repeated every 10 years. Prevents a infection caused by a bacteria called Clostridium tetani, which causes a disease called tetanus. Normally you get this from any type of contact with any type of a wound, where you have an infected wound where you come in contact with the soil. And the reason for this is this organism lives in the soil. So if you injure yourself and you have breakage of your skin and there's soil contamination or it's a dirty wound, tetanus is a possibility, which is why anybody who has this type of an injury, we recommend they go to the emergency department, and if they haven't had a tetanus shot in the last 10 years, they should get one. Routinely, it's given every 10 years just to prevent, so that at the time when that happens, you don't have to rush. If your wound is not badly infected, you can take care of it at home and you don't have to rush to the emergency room to get a vaccination. Again, adverse reactions is a little bit of fever and pain at the injection site. Otherwise, there's really no other contraindications to getting the vaccination. Herpes zoster. This is an important one that I want to talk to everyone about. Herpes zoster is a virus. It's a virus that causes the disease called shingles. And it's in the same family as varicella virus, which causes chickenpox. So the way that herpes zoster causes infection is kind of interesting. It's not something you can pick up from somebody else who has it. It's not something you can pick up from the environment or from the hospital. It's actually everybody who has herpes infection has it because it's a reactivation of the virus that they already have. So if they were to have been infected with chickenpox in childhood, and then there's reactivation of that virus in adulthood due to a number of different reasons, then they develop the disease called shingles, which is due to herpes zoster virus. Common reasons why you would get herpes zoster is decreased immunity. If you're ill, if you have a chronic illness such as diabetes, if you have cancer and you're on chemotherapy, if you have, just as you're aging and your immune system is not working 100%, and in addition to that, you have an acute stressor, an acute illness, even stress, just, life stress, herpes zoster can emerge. And I'll show you a picture. It typically causes a skin rash, which is very typical that we see. These raised red vesicles, which are very painful, can occur on any part of your body, commonly occurs on the lower back. And the thing that is very distinctive about herpes or shingles is that it occurs on one side of the body, doesn't cross onto the other side. So that's how you know what it is when you look at it. So the shingles vaccine, which is called Zostavax, was developed approximately 10 years ago in response to the growing number of people who were getting bad cases of shingles as they grew older. This vaccine is given to prevent shingles. It's recommended for all adults over the age of 60. The benefits that were proven in a trial that they did with about 40,000 patients, where they looked at patients who were vaccinated versus patients who received the placebo, was three things. The first one is decrease the incidence by 50%. So those who were vaccinated had 50% less incidence of shingles versus those who were not. It decreased post-herpetic neuralgia by 67%. So I want to explain about that. As I said, shingles causes a rash, which is red and raised and very painful. A lot of people who develop shingles get this condition after the viral infection, where they get pain. And it's a very distinctive type of pain where it's a nerve pain. People have described it as burning. They feel like their skin is on fire, stabbing. After the infection resolves, after the rash gets better, the pain still stays with them. And the vaccine, if a person is vaccinated, and if unfortunately they still develop shingles, they won't have as severe of a case, and they won't develop, 67% of that won't develop the post-herpetic nerve pain. And finally, decrease the overall burden of illness. Again, just like the influenza vaccine, the vaccine is not 100%. So if you get vaccinated and you unfortunately happen to develop shingles, you will at least not develop as severe of an infection. You will get an infection, but it won't be as bad as it could have been if you weren't vaccinated. Some things that to know: if the vaccine is not recommended if you're allergic to gelatin or an antibiotic called neomycin. People who are pregnant, women who are pregnant, and people who have a compromised immune system should not receive the vaccine. And again, zoster vaccine prevents shingles, which is a disease caused by the virus herpes zoster. So here's a picture, which I'm sure some of you are familiar with, of what the rash looks like in shingles. It's usually these raised red lesions. You can't see it clearly in the picture, but it's usually on one side of the body, and it doesn't spread over to the other side. Yes? So for the Zostavax, whether you should be revaccinated after you're vaccinated as an adult, honestly not familiar, no. As far as I know, it's just a one-time dose that you, after the age of 60, everybody should receive. Yeah. Okay, so pneumonia vaccine. This is another common one that a lot of you have probably come across. Children and adults aged 2 to 64 with certain health conditions, and all adults over the age of 65 should receive the pneumonia vaccination. So the certain health conditions are listed here, and these are people who are at increased risk of developing pneumococcal infection. These are people who have diabetes, have cirrhosis of the liver, suffer from alcoholism, chronic kidney disease, chronic lung disease or COPD, heart disease, asthma, any sort of compromise of their immune system, nursing home patients, and the first one there I want to talk about a little more, patients who have no spleen. So for one reason or another, if a person has their spleen removed, whether it's due to an accident or a trauma that it was an emergency, or commonly patients who suffer from certain types of cancer like lymphoma will have their spleens removed electively, these patients are at great risk of pneumonia caused by this organism, so they need to be vaccinated. This vaccine should be repeated every 5 years in adults over the age of 65. So this is one that you have to get again and again. because the immunity fades over 5 years. Again, common adverse reactions just like the other vaccines: fever, pain at the injection site, and fatigue. These are pretty manageable. Again, pneumonia or pneumococcal vaccine is given to prevent pneumonia caused by the bacteria Streptococcus pneumoniae. This is just an example. Okay, so, yes. For the pneumonia vaccination? What do you mean the first one or the second one? I'm sorry? Oh, I see what you're saying. There are two different vaccines for pneumonia. Good point. I didn't mention that here. There is two different types of vaccines for pneumonia that are given. The one that is given to children is the 13-valent vaccination. It contains 13 different strains of the bacteria. That's the one that's given one time. The one that's given after the age of 65 and repeated every 5 years is the 23-valent vaccine. So that's the one that you're repeating. Thank you. That's a good question. Okay, and then the final thing that we use to determine who should receive vaccinations is really based on medical condition. Okay, you can see the second table in there where you have things listed. It's really based on medical conditions. So, for example, there's a lot of information here, but I'll just give you some examples. For example, somebody who's pregnant, the flu vaccine is highly recommended. Okay, that's something that a pregnant woman should definitely get. If you're talking about, for example, somebody with a weakened immune system, again, the pneumonia and the flu vaccine should definitely be given. I'm going to look at kidney disease. So kidney disease is a good example. If somebody has kidney disease or poor kidney function, hepatitis A and B are highly recommended. Okay, because of the potential for progression of their kidney disease, that's recommended. Chronic liver disease or alcoholism, same thing. Diabetes, the ones that are highly recommended again are pneumococcus and flu, as well as the tetanus, because of the propensity for diabetic patients to get injuries or infections on their skin, and the tetanus vaccination will prevent against that. People who don't have a spleen for one reason or another, as I explained, the common ones that they need to get is pneumonia, as well as meningococcal vaccination. I think that's it. Any questions specifically? Yes. Yes. Yes, they can. And the reasoning for that is, unfortunately, they already have the shingles, as I explained with the virus. It's already in their system, and it's going to reactivate. The advantage of getting the vaccine is if they get the disease again, it will not be as severe, and they won't get the pain, the post-herpetic neuralgia pain as severely. So they should still get vaccinated. Yes, that's a good question. Any other questions? Yes.
It says here that the PCV13 is also for adults.
PCV13 is also for adults, yes. Just not for after the age of 65. After the age of 65, the PCV23 is more recommended, and that's the one that's repeated so they're saying adults across the board, like over the age of 50. But for 65, the PC23 is the one that's recommended. 23 strains, yes. So it covers, it's more broad coverage, exactly. Yep. She was asking about the pneumonia vaccine versus the 13 strain versus the 23 strain, and she said the 23 is also recommended for adults. The 13 is also recommended for adults, which is true. Adults, in this capacity, they call adults over the age of 50, but for over the age of 65, older adults, the 23 strain is what's recommended. Yep. And then in your packets, you guys, at the very end, I included some what's called VIS, vaccine information statements. Many of you have probably seen this. Whenever you receive a vaccination at a pharmacy or at your doctor's office, they're required to give you this. This lists all the information about the disease you're being vaccinated for and all of the possible reactions you could have. So this is just good information to have. This is available, all of this information is from the CDC website, so if you wanted to read more, it's all there, so you can have more information about the vaccines and how they work and what's recommended. Yes. Sorry, go ahead.
I had, let's just say you didn't choose not to get the, let's say, pneumonia or flu vaccinations. Are there ways to help prevent getting the flu, or is it both bacterial? Is it?
The flu is caused by the influenza virus. Pneumonia is caused by a bacteria. Common practices to prevent it is just, cleanliness, common things that you would do. Wash your hands before eating, cover your mouth around people that are sick, things like that. Just common things. Unfortunately, not as helpful as it could be. So the vaccine gives us some extra help. Yeah, absolutely. Yes. Yeah, question. Older people can get meningitis. I kind of didn't go over meningitis in depth because commonly we're seeing meningitis, which is also caused by a bacteria, seen in college students or young people who are living in close quarters. And the reason for this is different young people from different parts of the country or different environments are colonized with different bacteria. When they come in contact with each other, there's cross-contamination and they become infected. Older people can certainly be infected with meningitis as well, and it is a recommendation. Sorry? That died from it, from bacterial meningitis, or yeah, absolutely. So it is a recommended vaccination in adults as well. It's just not emphasized as much because it's not as commonly seen, but it's one of the recommended on the list. So it should be given to older adults, absolutely. You can get it in your doctor's office. All of these vaccinations on the first page or anything that's listed here, because they are recommended by the CDC, they should be covered by Medicare. I don't know, with private insurances, it's plus or minus. There should be a reduced cost, but because they're recommended based on your medical condition or your age, they should be covered. Absolutely. Yeah.
Did you say shingles are covered by Medicare?
Shingles is covered by Medicare. Yes, absolutely. Yeah, absolutely. Shingles, if you're over the age of 60 and you're going for your shingles vaccine as recommended, it will be covered. Absolutely, yes. They didn't cover yours, ma'am. Yeah. Right. Was that a copay or was that the whole amount? Really? Should have been covered. Yeah, no. It depends on how it's, I'll tell you honestly, I run into that in my office too. It depends on how your doctor or their office submitted it. So it should be covered completely, or at least you should have a reduced copay, as far as I know. Yeah. It is. It's very expensive if you pay out of pocket, right? Yeah, absolutely. They weren't covering. Okay. I wasn't aware. All right. Thanks. Exactly. Okay. Yes. Sorry? What was that? I didn't know. Where, in the health department, or where were they doing it? In the health. A lot of them do, yeah. Really? Okay, I wasn't aware, yeah. I know that a lot of my patients either get it at CVS, as she said, or at their local pharmacy, bring it in, or all of the pharmacies locally do it as well. But yeah, all of the health departments in different townships certainly do. The common ones will have on hand, so it's good. Yeah.
From a player
Yes.
or other towns, you check the health department in the town. They used to.
Last year I checked and they wanted $100 for the shingles vaccination. It wasn't free.
In the town.
Medicare did not cover.
No, I'm talking about the health department.
I'm talking about the health department.
Okay, thanks very much, everyone.